And Jim, is it Jim? The link?
Jim Silva.
Yeah. And I'll be right there. Turn this on.
And it's Joe and Tad, right?
Yes.
Okay.
Correct. Very good.
So when you do a shift tonight, you said,
Mm-hmm.
are you working in an ER?
All my shifts are in the ER, and yeah, I'll be working out in the triage area tonight. So.
Do you do that at Community Regional?
Mm-hmm.
Yeah. How many shifts do you work a week?
So I work less than other people because I work a second full-time job. So I work 8 shifts per month.
Okay.
Mm-hmm. Yeah.
2 a week.
Yeah, but we'll see how things
Because you're
change.
teaching the rest of the time.
Yeah, I'm doing my other job, which is the medical education.
Right.
And then I also am the fellowship director for the medical education fellowship.
Yeah, we got this whole chunky thing of all the stuff that you're doing. I
Mhm.
can understand all of it. Yeah, it looked pretty busy.
Busy. It's busy. Yeah.
Is your husband a doctor too?
No, but we get to work together because he does, he produces the videos with me.
Oh, okay.
He also does all the graphics for the company.
Cool.
And yeah, so we basically both get to work
So he's a
together.
web guy.
Yeah, not web design, but graphics and video. Yeah.
That's good. Video production.
Yeah, it's very helpful.
Joe, when you're ready, I can get your phone. We still got a little bit of time, right? 10 minutes?
Yeah. All right, I got my phone here. I've got it's charged up more. Here is the, this is all queued up and ready to go. I want to put that on the,
Okay. And
Making sure my phone's charged with that.
oh, that's already, did you send that to?
I sent that to Dan.
Okay. Sorry, Siri.
Let me get a shot of you, Tad, and
Okay.
Dr. Mason. There we go. Good, thank you.
Sorry, doctor. Our social distance wasn't
Yeah,
well.
that's probably
6
not
feet.
a good photo, actually.
I tried to at least give you Well, when you're not involved with all those
He says
tasks,
we're already live
what
on
else do you do?
On YouTube.
I have a baby at home.
You do?
Yeah, he's 8 months old.
Wow,
Yeah,
congratulations.
thank you.
That's busy time.
So I hang out with him.
So we're already, I guess it's already live on YouTube, so
Oh.
FYI.
Okay,
Okay, so,
that's good to know.
Yeah.
keep it clean.
Always. You have another copy of the question?
Oh, do you want this back?
I needed those, yeah.
Yeah,
Wait,
here you go.
Okay. Because I had to, got the.
Do you want a copy, doctor? Because I can look at it on my screen. I can
Yeah,
talk
he's got
back and forth.
No, it's okay. I
I
don't.
think if you're just spontaneous.
I don't wanna be looking down.
Yeah, exactly. Whatever works for you.
A few minutes away.
8-month-old.
I would like to have some of the data open from my phone. I don't know if that's seen in the shot or is distracting.
It's fine.
No,
Wait,
this
a little
is
bit.
casual. This is not
Okay.
like, 60 minutes or anything.
It's like 30 minutes, or 45 minutes.
Okay, I'm gonna look at the YouTube. Is it, so where's the live?
You want to send me a link?
And so where do I find it on here then?
Use that.
Because I'm gonna have to look at the, oh, here it is, I found it.
Got it?
So it looks like we already have 8 people on it, but,
Well, we're not saying anything. So wait till 2:30.
yeah. So if you're out there, we're starting officially at 2:30. And that's when we'll start asking the questions.
Well, I just would come up on this.
Yeah, on Facebook there.
Our Facebook post
So you'll
showed
see
you
it
from your filming.
Oh, great,
It's a little cross promotion.
cool.
Yeah, and there's, someone says that was less than 6 feet, just saying. Can you guys see the chat?
Yeah, I can see the chat, yeah. And then the big one will be Facebook, we'll have a lot more audience.
Well, so I mean, to address the YouTube audience, yeah, we're less than 6 feet, but that's how you're going to be able to see us in the video today. So, you know, we're all sacrificing our health for your benefit there.
I think the 6 feet rule is more for people who are symptomatic.
Right.
Oh, okay, all right.
Yeah.
Well, none of us are symptomatic.
No, we're okay without them. The LA Times had a really interesting story today about an 81-year-old man from Southern California who'd gone on a ski trip to Italy. And then upon returning at the airport, he was symptomatic. So he actually called his primary physician from the airport, said, "This is what's going on with me." And the physician said, "Well, go home and self-quarantine." And it's turned out that this 81-year-old man has had a very mild case. Been very interesting.
Well, most people in their 80s will. Yeah.
Well, and the person who was writing, I think it was his primary physician who was writing the op-ed, was making the point that this 81-year-old was in really good shape. Because he's still skiing at 81. He exercises an hour a day and does like weightlifting 3 times a week or something. Doesn't smoke, doesn't drink, and eats very well. So, you know, the broader point was take care of yourself.
Yeah.
You're gonna be
We
fine.
hope that the things we do in trying to, in the spirit of good health, we hope actually protect us.
Right.
What do you call
Well, I have to shut my phone.
it? Okay, here, we'll just on my phone.
Hey, it's Craig. I'm here with Joe. Sorry, my phone's on live, so.
And then the Facebook thing will just pop up and say Joe. So it hasn't really started that yet.
Yeah, we just have, a couple microphones kind of pointed in her direction. So. That rig set up on the phone, for the phone. Yeah, there's another mic for Facebook Live.
There's a couple of questions already.
Good. Well, so.
Jennifer said that we got 2 questions from
Okay. She was just.
that forum that you were talking about. One of them
We
was,
got 3 cameras on
they've heard that the virus doesn't like warmer weather. Tom Hanks and his wife have contracted the virus, even though it's late summer and
there. That's
Australia, so they contracted elsewhere. Hardly. How would you answer that?
I think that's still speculative. We hope that, like other viruses, there's seasonality. And that, you know, in a few weeks, when the weather changes, or in Fresno, that's already happening. We hope that that works to our advantage and buys some time. But no one knows for sure. It's too new.
Also, there's another question that was kind of funny. Does the virus cause stomach issues, and why are people buying up all the toilet paper?
I think that very unusual that it causes stomach issues, GI upset, diarrhea. Those are not the common symptoms. I think people are buying all the toilet paper because of hysteria and wondering, you know, like what can you stockpile that you think is going to be a valuable, needed resource, and everyone went straight to toilet paper. I really wish people would stop doing that. You don't need that much toilet paper.
Yeah.
Okay, can you give us a mic check real quick? Just talk.
Yeah.
Just talk.
So we were talking about toilet paper. Why are people buying it in mass quantities? Probably just sort of a mass hysteria, and people should not be buying that much toilet paper. So, yeah, I think that's one of the things people should probably relax about.
Yeah. All right, good. Okay, we're almost ready. I need to get that phone.
Let's go to the Canon. That's the third camera. Yeah, we wanted regular video
For my
as well, so.
It was posting on promo, Joe, that I wanted TV sections.
I think we gotta go. It's like 2:29.
Okay. Let me just take off the loud mic, and we can just work that out some other way. Okay. Oh, okay. Yeah, I mean, we're running this on Facebook Live and YouTube Live. It's not really, I don't know how to do that. Okay.
It's always nice to get that last minute. Let me just pull this off of you because I think we're getting interference
Okay.
on that one. Thank you.
Got a fan out there?
My son.
All right, we're already live on YouTube, so we're gonna get Facebook set up here, and then we're gonna start going. So if you can put that up there and hook up the microphone and then hit start, we will start.
All right, we're starting.
Okay.
Here. And it's live now.
And we are live here. My name is Joe Kita. I'm the editor of the Fresno Bee, and I'm here with Tad Weber. He's our opinions and editorial page editor. And today we are absolutely delighted to have a special guest with us today. Her name is Dr. Jessica Mason, and she's an emergency medicine physician at UCSF-Fresno. She's also an assistant clinical professor of emergency medicine and has created a popular podcast about medicine called This Won't Hurt a Bit. I love that name.
Thank you.
And that podcast also has a worldwide audience. So welcome, Dr. Mason.
Thanks.
Obviously, COVID-19, coronavirus, however it is termed, is something that everybody's talking about right now. And we wanted to kind of find a way to dispel some myths and misinformation and also answer questions from our audience here. And so we are going to have people who are online right now. If you could ask questions in the chat next to the live video. Tad and I are going to be monitoring those questions, and then we're going to ask them. But until then, we're just going to start off with some questions that we prepared, and then we'll move into taking questions from the audience. So let's start out here with the first question. Is how do you catch COVID-19, and can a person inhale it?
Mm-hmm. Yes, so coronavirus 2019, which I'm going to call COVID-19, that's what we're calling the syndrome that is caused by this coronavirus. Our best estimate right now is that this is probably caused by respiratory droplets, that is how it is transmitted. So if you are infected with the virus and you cough or sneeze, the particles that come out of your mouth and nose are floating in the air, and then I can come into contact with them, likely by inhaling them, possibly by ingesting them, although no one knows for sure. So that's the most likely way that this is transmitted, but it's also possible that it's transmitted by those particles landing on a surface, my coffee mug, for example, and then I take a drink from the coffee mug some immediately or sometime later. And so there's also a lot that's unknown. And viral particles have also been found in infected patients' blood, urine, and stool. And we don't know if those are actually transmitting the disease to other people. But the leading theory right now is that it's predominantly respiratory droplets from coughing and sneezing.
So how long will a virus live on a surface? First part of that question, and the second part is, what's the best way to get rid of it off of a surface?
So that question reminds me that I should state up front that a lot of what I'm going to say is based on the best information that we have right now. I am doing my best to stay very current on any of the scientific literature being published on this, but things are changing very rapidly. So what I say today might be different in a couple days when new information comes out.
Okay.
And that's true for this question in particular.
Okay.
So there is some information that suggests that these viral particles could live on surfaces for many hours, or perhaps even in the air, floating in the air for a few hours, for 2 or 3 hours. And so it's not really known, you know, if there's viral particles here, what does that mean 10 hours from now? We don't really know how infectious this particular surface would be. But currently the thought is it's probably several hours.
Okay.
So, if I'm at home and I'm not feeling well, when should I go to the ER? What symptoms would I have to exhibit to go to the ER?
This is a key question, because I would say if you're feeling mild symptoms, it is probably best to stay home. If you have particular risk factors for having COVID-19, so those specific risk factors being you have traveled to one of the hotspot areas where there are a lot of cases, or if you have been in close contact with someone who has a confirmed case, then that's very concerning, and you should be probably calling the Department of Public Health or coming in for testing. And if you're going to get testing, it does help if you're going straight to your primary care doctor to give them a call in advance so they can be prepared for you when you arrive. If you have mild symptoms and you don't have any of those risk factors, travel to hotspot, close contact with someone with a confirmed case, stay home. Just stay home like you have the common cold. It's very likely you probably do have the common cold or perhaps influenza. So when should you go to the ER? If you are feeling concerned that you have anything more than a mild symptoms, if you're feeling very sick, if you're feeling short of breath, anything that makes you concerned, and I would lower that threshold for people who are what we consider more vulnerable populations. And those vulnerable patients would include people who are elderly, particularly if you're over age 70, and people who have underlying chronic medical issues, especially heart disease, lung disease, diabetes, or anything that affects your immune system, your body's ability to fight infection. So if you are one of those people, then I would say, you know, arrange to be seen, whether that's in the ER or your primary care doctor or calling the Department of Public Health, our county health department.
So let's say somebody does have COVID-19 coronavirus. How long are they contagious? And does that extend for weeks, or does it just for days? Or I mean, people always say that, you know, after you have the flu, after a few days, you're no longer contagious. You know, when are you no longer contagious with COVID-19?
The best answer that we have to that right now is probably 12 days. But there are some cases where it's been infectious much longer than that, so it's not really very clear. But probably in those early days, you're probably more infectious, and then it probably tapers out as you get closer to 12 days.
All right.
That's why the quote-unquote quarantine period is 12 days. It's based off of this idea of when are you most likely to transmit the virus to someone else.
Okay, great. I think we'll come back to that in just a second, but I have a question here from a Facebook viewer that I think a lot of people actually have, and that is, can animals get the virus? People are thinking about their home, their household pets. So what would be the answer for that?
Currently, the thinking is that our dogs and cats and common household pets do not get COVID-19, nor do they transmit it to us. But that's different than, like we talked about earlier, if someone coughs or sneezes on this coffee cup, there could be viral particles on the coffee cup. The same would be true for your dog's fur, right? So if someone's sick and they cough on the dog and then someone else pets the dog, you're not catching it because the dog had coronavirus. You're just touching something that there could be viral particles on. And that's why for people who are in home isolation, the recommendation is that the pets are not kept with them.
So the pet becomes a surface for the virus?
Yes.
Okay, so that's good to know, so be
Yeah.
careful with your pets.
And I understand the concern with this question because the virus is thought to have come from animals, not your common house pets, a specific species of bat, and perhaps a specific species of anteater in China that may have been involved as hosts in this infection. So it did come from animals, but this has nothing to do with our common house pets.
Okay, great.
So we're getting some questions now, and more are filtering in here. This one's from Facebook. The question is, I work in a building with over 400 people. Should I be worried and possibly stay home and away from work and the public because of COVID-19?
I think a lot of businesses, when possible, are trying to move to work from home models when that's feasible. This very much depends on the nature of your work and where you work. So if I'm assuming this is someone in Fresno, since that's probably our audience, is people in Fresno. Fresno has only one confirmed case of COVID-19. So it's very unlikely that by going to work that you're going to be in contact with someone with the virus at this point. Again, this is rapidly evolving. And it depends how much personal contact are you having with other people. What's the sick policy where you work? Are you encouraged to stay home? I sure hope so right now. If you're feeling any sort of symptoms that could potentially be coronavirus, that you are encouraged to stay home.
So remind our viewers, because some of them were asking about it right before we started, we're not following a 6-foot limit here in how we're sitting together. Talk about that 6 feet again.
So let's talk about social distancing.
Social distancing,
What this
yes.
really means. So social distancing is a containment technique on the large scale of basically avoiding mass public events, mass gatherings. Because the more mass gatherings, of course, it's likely that one person there has it, passes it to a couple other people, and it just increases that spread rapidly.
Sure.
So social distancing, we're trying to avoid these big public gatherings to slow down the rate of the spread of the virus.
Okay.
This 6 feet barrier that keeps coming up, that more relates to if someone's symptomatic, you want to be 6 feet away from them. When we're working in the emergency department, we have someone who has infectious symptoms, we're trying to maintain 6 feet between them and other patients. So I am not worried about sitting 2 feet from you, Tad. I think it's okay. Yeah.
Okay, thank you, very good. Okay, I wanted to come back for a second to the quarantine idea. So somebody is symptomatic and they need to self-quarantine. What does that mean and what does it look like?
So I think there's very specific definitions to isolation and quarantine. These are all available on the CDC website and our Fresno County Department of Public Health website.
CDC is Centers for Disease
Center for
Control.
Disease Control.
That's a federal agency.
Yes, cdc.gov has really excellent information and a lot for the public. It's not just for healthcare personnel.
Okay.
And so it depends on your particular circumstance. So I don't want to give just general advice. It very much depends. If you are a confirmed case of COVID-19, again, there's only one that we know of as of today in Fresno, that's a very special circumstance for what quarantine means for you. If you are a person who has been in contact with someone with known COVID-19, then it means something slightly different. And this is going to be best communicated by the Fresno Department of Public Health about what those restrictions exactly are.
And that agency would be telling the person what they have to do?
Yes.
Okay.
Now, if you just tomorrow wake up and you're like, oh, I don't feel so well and I've got a little bit of a cough, and you decide, maybe you call your doctor, you should call your doctor and say, this is what's going on with me, what should I do? If you're advised to just stay home and stay away from other people, that's different than someone who's under strict quarantine, right? That's just sort of smart advice. You're not feeling well, just in case, we're gonna be very cautious, keep you home, keep you away from people who are the vulnerable populations that we talked about. And I'm gonna say again who those vulnerable populations are, because I think that's one of the key messages that I really want people to hear. And that's the elderly, people with underlying chronic medical conditions like heart disease, lung disease, diabetes, and other problems that affect your ability to fight infection.
So about chronic medical issues, and we're getting a few questions about this. How about asthma? Obviously, that's a large problem in the valley with our air quality. Is that something that could potentially impact, that COVID-19 could potentially impact?
I'm sure that probably depends on the severity of the asthma. And that's not, I believe that's not been one of the things that's been specifically looked at. I think we're more talking about chronic obstructive pulmonary disease, people who are long-term smokers or current smokers, they're at higher risk. People who have mild asthma, I am speculating that that is probably far less concerning than someone who has very severe asthma, who's on, taking steroids and using inhalers very frequently. So it's probably a very wide spectrum of what that means in terms of an individual's risk.
I have a question from a Facebook viewer who says that he had a massive heart attack a few years ago. He lost 50% of his heart function, and now he has 2 stents, a pacemaker, and a defibrillator. So is he in a group that's more at risk than a person who hasn't gone through what I have?
Yes, that's absolutely fits that criteria that I was mentioning of someone who has underlying heart disease.
Okay.
And for multiple reasons.
Right, okay.
Another one that we're starting to recognize is elevated blood pressure, so hypertension. If you have high blood pressure, that's another potential risk factor that you might get a more severe form of coronavirus. And a lot of people have high blood pressure.
It seems that the symptoms of coronavirus would be very similar to symptoms of other kinds of typical winter colds and flu that we get. Is that true?
That's exactly true. And that's why this is so challenging. One of the many reasons why it's so challenging. There's no way to tell clinically just by talking to someone or looking at them, do you have coronavirus or do you just have the common cold? Or maybe you have influenza. There's really no way to tell that. And that's why we're relying on a very specific test to try to confirm cases that we think were particularly suspect for COVID-19. So it's not just having those symptoms. Again, it's having those symptoms and having a concerning exposure, travel, or exposure to a known patient with COVID-19, or travel to other hotspots throughout even the United States where there are currently a lot of cases.
Okay. One of the questions we keep getting frequently here is it possible that people who maybe thought that they had the flu or a common cold actually had COVID-19?
It's possible, but at this point I think that that's unlikely. There are so many cases of influenza and of the common cold, and I'm sure we'll start to see cases of COVID-19 rising, but we are so early on that curve right now that if you were sick a few weeks ago, you probably just had the common cold or influenza or some other respiratory illness.
And another question we're getting and multiple times now is how does this affect infants and babies?
So fortunately, we see very few cases. Actually, I checked as of a couple days ago, and I don't think there's new data on this. There have been 0 deaths in children under age 9. So are kids getting it? I'm sure kids are getting it, and there are documented cases of children testing positive, but fortunately they tend to get much more of a mild illness than older adults.
One of our Facebook viewers was asking, would the flu vaccine protect against this?
It does not specifically protect against COVID-19, against coronavirus, but it is a very, very good idea to have your flu shot every year, and in particular in a year like this, because if you have your flu shot, then it makes it less likely that you get influenza, obviously, right? And if you don't get influenza, then you're not coming to see us in the ER with flu-like symptoms that could possibly be coronavirus, and you're not being put in an area in a lobby or in another area where you're near other people with infectious symptoms. So the flu shot's not specifically protective against coronavirus, but it's very protective against similar illnesses.
The flu vaccine, though, wouldn't lessen the effect of COVID-19?
I don't think there's any evidence
So
to
there's really no
suggest
relationship
that.
at all?
No,
Okay.
not that I'm aware
That's good
of.
for the readers to hear.
Yeah, but you should still get your flu shot, and even though we're coming into the later portion of the flu season, if you have not had your flu shot, you should still get your flu shot. I think it's incredibly ironic that so few people actually get their flu shot, and everyone's itching for a COVID-19 vaccine. Everyone's like, when are we gonna get the vaccine? Well, we have a vaccine against influenza, which causes way more cases of illness and severe illness, and I don't know the exact numbers, but a lot of people don't even get the flu shot. So go get the flu. It's still not too late to go get your flu shot.
This is the doctor chiding us all to get our flu shot, so we appreciate it.
I mean, it would be crazy if you're like, I can't wait for my COVID vaccine, but I'm not going to get the flu shot because it always gives me the flu. It does not cause the flu. Go get your flu shot.
The pneumonia shot doesn't help either. Is that true?
Same answer.
Okay.
It will not prevent COVID-19,
Okay.
but it may prevent pneumonia,
Right.
which would also bring you in for the same reasons and expose you to all sorts of infections that live in the hospital and in the lobby.
Okay.
So we hear a lot about comparing COVID-19 to influenza,
Mhm.
and we know that many millions of people contract influenza every year.
Mhm.
If COVID-19 infects at the same rate, is the death rate going to be higher?
So COVID-19 is thought to have a higher mortality rate. So it's thought to basically kill more people. But influenza causes, it's so much more widespread. So if you get influenza, just in general, and this is very different depending on age and comorbidities or other medical conditions, if you get influenza, your chance of dying is less than 1%. It's probably about 0.1%. So most people get the flu and they're fine. But there's so many cases of influenza that tiny percentage actually equals to a large number of people getting very sick and dying from influenza. With COVID-19, although there's way fewer cases, the death rate is higher, especially in those vulnerable populations that I keep mentioning. And so that's the concern, is that if you get it, you actually have a higher chance of dying if you are one of those vulnerable people.
We have a couple questions from Facebook that are both under the heading of being in groups of people.
Mhm.
So the first one is a worker who says she works in a building with 400 people in the building.
Mhm.
It's a large company, I assume. So what would be tips for her to stay protected in that setting?
Yes. So if you don't feel well, stay home. If you're worried about protecting yourself from everyone else's germs, which we all are, frequent hand washing and hand sanitizer, and staying away from people who are sick. I know that sounds like very generic advice, and in many ways it is, but that's sort of the best that we can do right now. At this point, it is not recommended that you walk around or go to work wearing a face mask. So just good hand hygiene and trying to avoid people who are sick.
Now, doctors wash their hands a lot. So when you're washing your hands, what's the song that you're humming to yourself?
I don't have a song.
You don't have a song.
We use hand sanitizer all the time. So hand sanitizer is a really good idea. It's easy if it's even available. I don't know if it's like on the toilet paper list where it's it's sold out everywhere. But an alcohol-based hand sanitizer that has at least 60% alcohol in it is good at fighting infections.
60% alcohol.
Mhm.
Okay,
Yeah,
good.
you don't want the
So that'll kill the virus.
Yes. So that, or hand washing. So using soap and water and washing for at least 20 seconds, covering all surfaces of your hands and your nails.
Both are effective.
Yes, both are effective.
Okay.
So why is there so much attention on people touching their face, and why that could potentially be a bad thing
Mhm.
with this virus?
It's so hard to not touch your face.
Yes, I know, I feel myself
So
dedicated.
hard, yeah. And so we don't know if there's viral particles on something or someone comes into contact with something and you touch that. Your hands are constantly interacting with your environment. So if you can try to keep them away from your mouth, your nose, your eyes, and potentially spreading infection to yourself, that's the reason why you should try to avoid touching your face.
So you can contract an infection through your eyes?
Probably.
Okay.
Probably.
We also got a question here from a reader who submitted this through our online forum. It says, my wife recently finished chemotherapy. Should she self-isolate, and if so, for how long?
I would be particularly cautious because it sounds like this person's wife, by the way, I hope she's doing okay. She is one of the people who's considered to be vulnerable. Her immune system's affected by chemotherapy, of course. And so I would be very cautious about where you're going. You know, I wouldn't go anywhere where you're going to be around large crowds. I'd be very protective about people coming over who could potentially be sick. So I hope that answers the question, but just the sort of normal levels of caution, I would amplify that in someone who is immunocompromised. And that would be if she starts to show any symptoms whatsoever, she is someone who should reach out for medical care very early.
We have a specific question from somebody who wonders if they're taking biologics for autoimmune diseases, are they at greater risk?
Not known.
Okay.
Not known. I'm sorry, I wish I could give more information. It probably depends on the type of biologic.
I wanted to go back to a previous question, which was the other lots of people involved, and that's the gym. And a lot of people in Fresno love going to the gym to work out. With the hot weather coming, they're going to do that and avoid the heat of the day. What are the dangers of doing that?
I think at this point, if you're otherwise healthy and you're going to the gym, that's probably fine. This recommendation could be one that changes really rapidly. So we'll see where things go in Fresno in terms of the cases that we're seeing. If you are, like you had asked me, Joe, this particular person's wife who, you know, is immunocompromised, undergoing chemotherapy, probably not going to the gym anyway, I would be more cautious. If you have diabetes, if you're older, I'd be more cautious. Maybe there's other ways to exercise that you're not exposing yourself to so many other people, and especially in a place where so many people are touching things.
Right, you're sharing equipment.
Yeah.
A lot of gyms have the hand sanitizing stations, just use them frequently.
And I'm sure you could bring a little packet of some disinfectant wipes and wipe down your treadmill, and there's probably ways to make it a little bit safer for yourself. So right now, like I said, this could change. If you're otherwise healthy and you enjoy going to the gym, it's probably fine. If you're a vulnerable patient, I would be more cautious about doing that.
Okay, that's good advice, thank you. Joe, do you have another one?
Yeah, we had talked a little bit before about that curve and flattening the curve.
Flattening the curve.
What is that, and why is that important to talk about?
Yes, it's a trending hashtag.
Yes.
So this is part of the whole concept of social distancing. I wish I could draw on a whiteboard. If you can imagine the number of cases of coronavirus in your community or your state, wherever, we expect that with how infectious coronavirus is, that we'll start to see a rapid increase in the number of cases with time. And the faster this rises, and the more straight up it rises, it's more likely that the available hospital and healthcare resources are going to reach their capacity. And so flattening the curve is the idea that, hey, maybe if we can slow down the rate of spread, we're not changing the total number of cases that will occur. We're just trying to spread them out over more time. So instead of this many cases occurring in days and weeks, it's rising more like this. We're not as likely to overwhelm the resources that we have so quickly.
Okay.
And social distancing is one of the strategies to try to flatten out that curve.
So another question we had, this is through Facebook, and this is the person, he says he's scheduled to have gallbladder surgery next week. Should he be concerned or reschedule this with everything that's going on?
I think that's a decision that you would have to make on an individual basis with your surgeon. And I also think that, it's evolving so fast. I would probably reach out to your doctor and have that conversation and see if that's a good idea or not. Some people are going to have, if they have really severe gallbladder disease, it's probably not as good of an idea to wait. But if it's something that can wait, perhaps that's something that your surgeon would want to recommend.
Several of the Facebook questioners are asking about whether they should cancel small gatherings like birthday parties, maybe a child's birthday party or that kind of thing. What would your advice be?
That's tough.
10 to 20 people, for example.
Yeah. Right now, small gatherings, the smaller, the better. But I would be cautious because even though children are doing very well compared to older and more vulnerable populations, they can still get the virus and bring it home and get the parents sick and then get the grandparents sick. And birthday parties are a time when usually families, multi-generation families are gathering. I would probably be a little bit cautious right now till we see how the dust settles and hopefully in the upcoming weeks and months.
Okay.
I don't know that I would say go cancel your kid's birthday party because that would be a heartbreak, but maybe there's other ways to approach it. Maybe there's some creative solutions there that you can still celebrate the purpose of the gathering and keep it small.
Keep it small, okay.
Got a couple other questions here that I want to ask. Who needs to wear a mask? And when would they need to wear a mask?
So when you say a mask, what you're probably talking about is the surgical face mask. These are the ones that are sort of commercially available, anyone can buy. It's the one that you pinch over the top of your nose and it's a rectangle. And those are actually designed to prevent the person wearing the mask from spreading their respiratory infections to other people. That's what it is designed for. So does it protect the person wearing the mask? I think it probably does, but there's not good evidence for that. There's air leaking around the sides of it, things can get in. So it is not the ideal mask. It's not the mask that we are wearing when we are taking care of someone who we suspect has COVID-19. We have a special kind of very tight-fitting mask that filters out very, very tiny particles. The standard surgical face mask does not do that. So who should wear a mask? If you come in to get testing and you come to your primary doctor or emergency department, wherever, and you have symptoms, you're probably gonna get a mask put on you, which is a good thing. It's gonna help protect the people around you. If you have immune system problems, it might not be a bad idea to wear a mask. So it's hard to say, and that's a moving target, and I think also controversial.
Right.
Another question, if a person self-quarantines at home, what does that entail? What should they be doing?
Yeah,
Or
again,
not doing?
so we touched on this earlier on, and it very much depends on the reason why you are self-quarantining. I'm gonna make the assumption that this question is coming from the place of, hey, I'm just not feeling well, kind of common cold symptoms, I think I'm just gonna stay home. If you actually have, specific reasons that you could have had an exposure to a COVID-19 patient, or you came from a region where there's a lot of cases, then you should be in contact with county health. I'm going to keep reiterating that because there will be specific protocols for what that means for home quarantine or home isolation. If it's just, I'm not feeling so well, I'm going to stay home, which is a good idea, then you should probably avoid contact with elderly, sick people. You should probably avoid large gatherings, stay home from work. But if you have any particular concerns, I would say go to the county public health website and see what their recommendations specifically are.
Another question, why don't antibiotics work to fight a virus?
Oh, I love this question. So antibiotics in general, they are designed to fight bacteria, not viruses. We do have some specific antiviral medications, but when we're talking about the common cold or influenza, there is no benefit to antibiotics, like the antibacterial type of antibiotics. So if you have COVID-19, there's no specific antibiotic. You can't take amoxicillin and it's gonna go away. Don't take amoxicillin, not gonna help. Might make it much worse, actually.
What's the difference between a virus and bacteria?
Right.
Oh, wow. Let's see if I can remember this from medical school. This is tough one, you guys. This is like going back to college.
Many people are asking.
Oh, wow. I think I'm going to keep this one kind of vague because I don't want to give wrong information, and this is like really going back several years for me. They're fundamentally very different. A bacteria is an organism that can live completely on its own. A virus has to survive by going into a cell and then using that person or animal's cell DNA to replicate itself. So it can't just replicate itself on its own, and it can't really survive for very long outside of living in someone else's cell.
A host.
So yeah, so because they're fundamentally different, the way that we design antibiotics to fight them are also very different.
We have both a doctor as well as several regular folks, I think, asking about testing.
Mm-hmm.
So I think you want to direct people who have questions about testing back to the county, is that right?
Yes. Yes.
So if somebody wants to get tested or a doctor needs to refer patients for testing,
Mhm.
what should they do?
They can look on the Fresno County Department of Public
I'm
Health
trying to
website.
set it up for you there.
Yes, that's where you can look.
Okay.
Yeah, there is testing going on at the county health. And so you can speak to them and they can direct you, because perhaps you can get testing done by your primary care physician. What we don't want everyone flooding into the emergency department to try to get testing there if there's other resources to get tested.
You should repeat that again, because that's really critical
Sure.
for people to hear.
Sure.
Don't flood the emergency.
Yeah, and I would never, I never want to discourage people from coming to the ER who feel sick and are concerned. I never want to discourage that. If you feel mostly well, but you're having some symptoms, you might want to check with the Fresno County Department of Public Health and see if you are someone who should seek testing. And that testing does not have to happen in an emergency department. There are several settings where that could happen. The
Okay.
Department of Public Health, perhaps even your primary care doctor. So they can direct you where the best place to go is.
Here's another question we keep getting. Does hand sanitizer do a better job of killing COVID-19 or other viruses than just soap and water for washing your hands?
I'm not sure the specific data to answer that. I believe they're equivalent, which is why the CDC, the Center for Disease Control, is recommending either.
Okay.
If somebody wants to go out to dinner at a restaurant, or maybe they want to go to a movie, what would you advise them to do?
Yeah, if you're otherwise healthy, at this point in Fresno, that's probably just fine. We have one confirmed case. This may change a week from now, so we'll see. If it gets to the point that we're seeing lots more cases, then we'll see if the advice from the Department of Public Health changes on that.
If you were to travel to the San Francisco area and go out to a restaurant up there, the answer would be a little different?
Yeah, don't travel to San Francisco right now.
Because they've had a lot of cases.
They've had a lot of cases. So we would consider certain cities in the United States to be more concerning than other cities.
Okay.
Fresno is still on the list where we're doing pretty well with one confirmed case. Los Angeles, San Francisco, Sacramento, these are cities that have multiple confirmed cases. And I wouldn't advise making any unnecessary travel to any of these cities right now.
And I wanted to come back to a unique aspect of living in Fresno that we touched on a little bit earlier, but let's repeat it again. Fresno gets hot.
Mm-hmm.
As far as this virus is concerned, is that a good thing, that our weather will actually get hot?
So there is speculation that coronavirus probably has a season. We don't know. It's a novel virus, so no one knows its behavior yet. But we suspect that probably it does have a season, and hopefully this starts getting better as we come into the warmer months. We will see. Hopefully that pans out to be true.
Okay. Why does it take a year to develop a vaccine for this virus?
Well, I imagine a lot of science goes into developing a vaccine. I haven't done one myself, but there's a lot of steps that I don't have knowledge of
Okay.
in designing a vaccine. But aside from designing it, the safety has to be validated. If there's a vaccine that came out tomorrow, I don't think I'd sign up for it. I would
Right.
want to know that it's been tested and that we feel like this is very safe to deploy on a mass public level. So that takes time, and it should.
Just takes time.
Yeah.
Okay.
And it's actually, it's happening very fast. Science and information is moving so fast on this. I mean, the DNA, or the RNA rather, of this virus was sequenced and understood so quickly
Right.
compared to other viruses and
Real
other
success
viruses.
in that regard.
So fast. So I imagine a vaccine is going to be probably just lightning speed in terms of developing vaccines. But we got to pump the brakes a little bit and make sure this is safe before we start giving everyone.
I want to note that we have posted on our Facebook page a link to County Public Health that people can use to get more information.
So I think you've answered this before, but I think it would be great to repeat it again. What are some of the symptoms that are red flags that should prompt someone to see a medical professional?
Okay, so it does present like many other common respiratory illnesses. Fever, cough, fatigue, shortness of breath. Those are going to be your most common ones. Sometimes sore throat and headache, but really the main ones are fever, cough, fatigue, and shortness of breath. And if you don't have all of those, that does not mean that you don't potentially have it. Fever is only present in about 50% of people when they first come to see a healthcare provider. Only about half of them have a fever.
Another question, I think I know what your answer will be to this because we've had a similar one already. This person is saying that he is a post-kidney transplant patient and he has a doctor's appointment at UCSF. Should he reschedule it until COVID-19 becomes controlled?
I think you should call your doctor. Yeah. And then the two of you can establish whether or not that is essential or non-essential travel, but that should definitely be worked out on an individual basis.
But in general, people who have significant health issues already are a bit more at risk than just a general person.
Oh, sure, but there's also a risk for someone like that not making their appointment, so that the pros and cons have to be weighed. If it was just a leisure trip, I would say no, but that doesn't sound like leisure.
So also talk a little bit more, and I think we brought this up already, but we should probably repeat it. So what is the definition of social distancing? And what should we be practicing when we're in groups of, let's say, 15 to 20 people or large groups?
So social distancing is trying to limit your exposure to other people at mass gatherings with the purpose of trying to slow down the spread of the infection. What was the second part?
And then how do we practice it?
Oh, okay,
What should
yes.
we do?
So
What are some good tips?
Sure. So if you are planning, if there's a large event, I would think twice about going to that and what defines a large event. Also, that is a moving target. Is it 20 people, 50 people, 100 people? Difficult to say.
Yeah.
But large events, you should really think twice about planning them, continuing with them, or participating in them.
We've had several moms-to-be post questions. Basically, are they at a higher risk because they're pregnant?
Thank you for asking that. That's a great question. There is very limited data about pregnant patients with COVID-19. Very, very, very limited. We have some information if we look at what SARS and MERS, which were prior epidemic viruses, and how those affected pregnant women. And can we extrapolate this to COVID-19? I don't know. Those particular viruses had very concerning effects on pregnant women. So I would be very cautious if you're pregnant about who you're around and what you're exposed to. We have documented, I think, only 6 patients from China who did, or 9 patients who had babies who were infected with COVID-19. They all did well. So that's very reassuring. We can't base recommendations off of 9 patients or 6 patients. It's way too small, so it's very unknown at this point. I think I should have mentioned pregnant patients in the group of potentially vulnerable populations. You should be extra cautious.
Okay, great, thank you.
So here's a question we got from our YouTube audience, and I think this is a good one. Please show people how to wash their hands correctly. So what would you have to do? Like, what's the right way to do it?
All right, so you're going to get some water on your hands and some soap, and you're going to lather all surfaces. So not just your palms, rinse, and you're done. You're going to get your palms, you're going to get the backs of your hands, you're going to get your nails, in between your fingers.
Okay.
And this whole process should take at least 20 seconds. And then you've lathered for 20 seconds, and then you rinse off.
Okay. So, well, I'm doing it all wrong then. I just went like this. Okay. Let's see if we have some more questions here.
Facebook audience is starting to slow down, so I think you've been doing an excellent job of answering their questions, Doctor.
Thank you, I hope so.
Yeah, no, I think so.
Here's another question. We've been getting a lot of these, and I'm not really sure if you're the best person to answer this, but when do we know when it's time to stop taking kids or children to school? I know that just before we went live here, Fresno Unified decided that it's going to be canceling classes next week.
Mm-hmm.
Any guidance on that? Or is it
I don't have any specific guidance on that. Yeah, those are difficult decisions to make.
Like health departments.
Yeah, right.
We do have a nice comment from Josette Adam, who's saying, thank you so much for asking all these questions on our behalf. This information is very helpful, and thank you, Doctor, for taking the time to share this information.
You're welcome.
So in general, maybe to wrap it up, let me say a few things, and you correct me, of course, when I go off course, but COVID-19, we've had one case confirmed in Fresno County. We can all take common sense precautions to keep ourselves healthy, including hand washing or the hand sanitizers. Both are effective. The 6 feet rule applies when we know we're around somebody who has the illness or has been exposed to the illness at least.
Or is feeling any sort of symptoms,
Okay.
even if we don't know if you've been around COVID, if you're just feeling unwell,
Somewhat
keep your
symptomatic.
distance.
Large gatherings, probably not a great idea. Small family gatherings, you're going to have to kind of be careful in planning those and carrying them out. Older people are at greater risk than children or younger people. Not enough of a sample size of pregnant mothers-to-be to know exactly how it's going to affect them, so mothers-to-be need to be careful.
Very careful, yes.
And really, this all just sounds like very common sense for any illness that would be in our population.
Yes.
Did I do okay?
Yeah, that was great.
Because you're a teacher too, so I hope I passed the test.
You passed, yeah.
Okay. Anything else, Joe?
I think we've got most of our, we have a new comment now, let's see. There's just a lot of thank yous, and we wanted to go for 45 minutes, and we're 45 minutes right on the button right now.
Okay,
So
well, thank you so much.
And we had a large audience here too. We had hundreds of people looking at it at varying times throughout the 45 minutes.
Great.
We've been live.
And I would just encourage people to stay current as well. Everything that we talked about here, is subject to change on a daily basis. So I'm doing the best I can to stay current, and I hope that everything I've said has been accurate. But just know that information is changing really quickly.
Well, thank you, Dr. Mason.
You're
Thank
welcome.
you very much. And thank you for watching.
Good job. That worked out
Thanks.
great.
Good.